I'm David Duffner. I'm an orthopedic surgeon in Palm Springs and Rancho Mirage, California. I developed osteoarthritis of the basal thumb joint in about 2012. Started first on my right and shortly after that my left. No history of trauma that I know of, but just doing surgery, and I did trauma for 30 years, and I did spine, pedicle screws, and those types of activities that required a lot of key pinch and thumb grip were becoming very painful. First, I treated the symptoms with anti-inflammatory drugs, and after a year or so, I started getting steroid injections. I had a hand surgeon colleague of mine inject with local anesthetic and steroid, typical thing. And at first, it was about every 6 months or so, and I got great relief for a while. But as is typical, you get to a point of diminishing returns. Then I started trying different braces. I tried the neoprene, kind of wraparound Velcro things, and they didn't really work very well. Well, I started thinking about surgery, and I'm not a hand surgeon. I don't perform that type of surgery, but I remember back in my residency, the so-called anchovy or the tendon interposition, also called suspension arthroplasty. I knew about that, and I've seen patients over the years that have had that done, and I just didn't think that would be very good for me because while it relieves the arthritic pain, you lose length on your metacarpal, and I think you also kind of lose some of the biomechanics of the joint are affected because you lose your leverage there. So I just really did not think that the anchovy procedure was a good option for me. Started researching the literature actually and just looking at what was available for thumb metacarpal joint arthritis, and I actually started going to some hand meetings, which I normally don't go to. Started going to symposium at the academy and a couple of hand meetings, and then talking to different high-level hand surgeons with a lot of experience and great reputation in this area, and looking at the literature, and I discovered the BioPro implant, and actually called the company and tried to get in touch with a rep to find out who does this in my area. And then pure serendipity, I ran into a colleague, a rheumatologist at Eisenhower Medical Center, Dr. Joel Hirschberg, and he had mentioned that he had very good results with referrals to Dr. Neil Jones. We started out with a telephone chat, and he was a very accommodating, very nice gentleman, and we ended up meeting and discussing different treatment options, and I decided this was the best option for me. Well, I was pretty anxious about it because obviously hand function is very important to a surgeon. I've had other orthopedic operations. I've had my knee scoped twice. I've had both rotator cuffs repaired. I was never anxious about those procedures because I do those procedures and I know what to expect. But I don't really do hand surgery like this, and I knew that this was new technology. It had good results reported in the literature, but just having never seen any cases like this, I was somewhat anxious about it. So Dr. Jones very kindly arranged for me to talk to a large animal veterinarian who did surgery, and he had both of his done. So I got to talk with him on the phone, and he was reassuring. He said it was a long rehab, a long and difficult and somewhat painful rehab, but he was back to normal function. So that was helpful. I had my right hand done in June of 2017. I was back to work in 3 months. The rehab was not as bad as I expected. I was started back in surgery in about 3 months, doing lighter surgeries, and then gradually progressed to full surgery. I was still using a brace on my left side. I used one of those little braces. I would sterilize it. I'd put it in the Sterad. I'd put on a glove, put on the brace, put on another glove, because this one was really subluxed even more. So then this one I had done in October of 2018, which is just 4 months ago. And I was a little bit faster in my rehab because I knew what to do. I was very careful about preventing dislocation. That's the main complication that you worry about. but I progressed through the cast and the splint and the functional bracing and the rehab actually quicker on my left hand. And I still have just a little bit of soreness, but I'm back, 100%. I can still work, which I want to do. I thought about retiring, and that would have been my only option if I had not had relief in terms of pain relief and improved function. So I could put up with the pain, but you get to the point where you really lose your functional ability to have a firm key pinch and thumb grip. So, I'm basically pretty much back to normal, although I don't try to do the real heavy duty surgeries that I used to because I don't want to wear this out. I'm sure there's still a place for the interposition arthroplasty for low demand patients, but for people with high demand, especially men who want a powerful grip, or women who sports or hobbies want a powerful grip, I just think this is the way to go. It just makes sense to me. Pleased to report that I'm really satisfied. I'm glad this was available, and I'm really glad I got to meet Dr. Jones. He's just been fantastic.